having a stroke.
Know the sudden signs. Learn fast. F. Face drooping. A. Arm weakness. S. Speech difficulty. T. Time. Time to call 911 immediately. The sooner they get to the hospital, the sooner they'll get treatment. And that could make a remarkable difference in their recovery. Learn the body language, the sudden signs, and spot a stroke fast.
All right. We could get out of that and flip over to my slides. That's going to start playing, I think. So my name's Kathryn Marquis, and I'll be presenting today on acting fast with strokes. It's all good. All right. We'll start off with disclosures. Next slide. I have no financial interests to be disclosed. So our objectives today are to be able to define a stroke, able to complete a fast exam, and use the NIH stroke scale. The emergency department will talk specifically about our abbreviated stroke scale. We'll also identify hospital requirements for a stroke patient, what we can expect from EMS, and what we can expect from our neurosciences units upstairs, and what is expected of us. And we'll be able to define what a stroke center is. So why do we care about strokes? Strokes occur on average every 40 seconds in America. About 90 people will have a stroke during this presentation, and about 15 people will die from a stroke during this presentation. It's the number 5 cause of death. 1 in 18 deaths, or 137,000 deaths a year, occurring on average every 4 minutes. Stroke deaths are more prominent in females than in males, although that depends on, that depends on ethnicity. Okay. What is a stroke? It's also known as a cerebrovascular accident or a brain attack. It's the interruption of blood flow and nutrients to an area in the brain. It causes an acute neurological impairment, and the extent of damage depends on size, duration, and location. So we say neuroscience is location, location, location. There are 2 types of strokes, ischemic and hemorrhagic. An ischemic stroke. This is the result of an obstruction within a blood vessel supplying blood to the brain. It can be thrombotic or embolytic. Thrombotic usually comes from atherosclerosis, whereas embolytic arises from an area outside the brain, cardiac in nature. These are 87% of strokes. Now that's a good thing, because we can fix these. When we get over to the hemorrhagic strokes, it's a little bit more difficult to fix. They're 13% of all strokes and occur when a weakened blood vessel ruptures. These can occur as either an intracerebral hemorrhage or a subarachnoid hemorrhage. Intracerebral hemorrhage being in the brain is caused by hypertension, illicit drug use, arteriovenous malformations, or trauma. And these symptoms are not immediate at onset and are not maximal at onset either. Subarachnoid, that occurs beneath the second meningeal layer, is usually caused by a ruptured aneurysm, and you have a high risk to rebleed. These have an extended hospital stay due to vasospasm. So I'm going to flip back and forth between this slide and the next slide, because I am incredibly visual. So if we can flip to the next slide, we'll talk about the MCA for a second. Just want to show you where it is. So the MCA is right here, near the circle of Willis. Okay, we can flip back. So these cause hemiparesis, so that's weakness on one side of the body, diminished sensation on the opposite side of the body, so hyperesthesia, blindness in one half of the visual field called hemianopsia, and gaze preference towards the side of the lesion. So if I have a lesion on this side, I'm kind of looking this way. Then we're going to talk about our anterior cerebral artery occlusion. We can flip back here. Anterior cerebral artery, right here. Okay. This causes disinhibition, speech perseveration, altered mental status, and impaired judgment. You have contralateral weakness, that's weakness on the opposite side of the body, and urinary incontinence. Next one is the posterior cerebral artery. Right here. Okay. This causes homonymous hemianopsia, so that's blindness in one half of the visual field with both eyes. Cortical blindness, so that is blindness in the normal appearing eye. Visual agnosia, so I have my flashlight here. I can see that it's a flashlight. This has nothing to do with whether or not I can see it. I just can't tell you what it is. And altered mental status and impaired memory. Okay. A TIA is a mini stroke or a warning stroke. Now, when you have one of these, your risk for having a stroke is much higher. This is caused by a temporary clot, and it causes no permanent neurologic impairment. These symptoms usually resolve within 1 to 5 minutes. Now, there are some risk factors for stroke up on the board. So on one side, I've placed things that we can't change: your age, your gender, family history. And then on the other side, things that we can change. We can take our high blood pressure medication. We can take our cholesterol medication. We can stop smoking. We can not use drugs. We can manage our diabetes. We can have a healthy kind of diet and physical activity. Okay. Things that we can't change: cardiovascular history, previous stroke, TIA, MI, heart failure, cardiomyopathy, congenital malformations. So act fast. We have the Cincinnati pre-hospital stroke scale. We did see a video earlier talking a little bit about it. I have another one. So we'll be assessing face, arm, speech, and time. And I'm going to pull up the Massachusetts YouTube video. And I apologize, because this will probably get stuck in your head.
Do you want me to pause this?
Sure.
How did you start this?
The red button.